Good afternoon. I had a few comments I wanted to make. In this session, I hope you can all hear me. I don't think that's on.
Yes, sir, we've got you.
Okay.
Thank you.
When this session began, I made a commitment that we would focus on making mental health a priority in Georgia. And here we will share with you the work that is underway. This is an issue that touches every Georgia family and matters greatly to Georgians. We began this year with a report from our Georgia Behavioral Health Reform and Innovation Commission, chaired by former Representative Kevin Tanner. This group brought together legislators, practitioners, law enforcement, judges, and other citizens to examine our broad network of behavioral health and developmental disability services. They produced a thorough report on recommended reforms. I want to thank Chairman Don Hogan and Chairman Mary Margaret Oliver for representing our House on that commission, and I am grateful for their outstanding service. I'll discuss our work in two sections today, both legislative proposals and additional resources through our state budget. As you now know, we just adopted the House version of the FY 2022 state budget that includes a combined total of some $58 million in additional funding for programs administered through the Department of Behavioral Health and Developmental Disabilities and their providers. And I want to thank Appropriations Chairman Terry England and Appropriations Subcommittee on Human Resources Chair Katie Dempsey for their work on this budget. Among the highlights, you'll see an additional $2.7 million to serve 2,100 more people with addictive diseases. You'll see an additional $6.5 million to serve 5,200 more people who require mental health services. We've also added $12 million pending CMS approval to increase rates for intellectual and developmental disability providers. And we've added $4.6 million in non-waiver services in family support. We're also appropriating $7 million to establish a first-in-the-nation behavioral health crisis center for individuals with intellectual and developmental disabilities. The FY 22 budget also adds funding to support the 988 National Suicide Prevention Hotline and other suicide prevention programs, as well as a full-time suicide epidemiologist. We know that COVID-19 has put a strain on our suicide prevention programs, and it is our intent to bolster these necessary services. We're also serving our young people by providing an additional $2 million in funding for the APEX program to expand that program to 59 more schools. We're also providing funding for suicide prevention training in schools and a youth suicide prevention specialist. Folks, that's just the 30,000-foot level view at some of the highlights. And while the numbers are impressive, what I hope you will take away is that this House of Representatives recognizes the need for these services and is prioritizing them accordingly. I'd like to also mention the good work that our House members are doing through their own legislative proposals. Chairman Sharon Cooper, Chair of our Health and Human Services Committee, has already passed through the House Bill 307, the Georgia Telehealth Act, which expands access to telehealth services and removes barriers for patients and providers. Chairman Don Hogan has House Bills 590 and 591. House Bill 590 proposes a pilot program for assisted outpatient treatment. House Bill 591, which we will take up and vote on later today or Monday, permits properly trained, licensed marriage and family therapists to sign Form 1013s, which mandate emergency mental health services. Chairman Katie Dempsey has House Bill 713, the Reducing Street Homelessness Act of 2021, which proposes innovative social support services to combat homelessness. All of these bills are moving through the legislative process as we speak. Our commitment does not end here. This is just a beginning, and we will continue to work on this critical issue both by providing additional resources in our budget and proposing innovative legislative solutions. I want to close this message. Before I do, I'll say part of our work is to remove the stigma from seeking help for behavior health or developmental disability services. It is nothing to be ashamed of, and it is nothing to hide from. If you need help, any Georgian, for yourself or someone else, the state has a hotline, and it is answered 24 hours a day, 7 days a week by trained professionals who can connect you with the services you need. The phone number for the Georgia Crisis Access Line is 1-800-715-4225. You can also visit the website at georgiacollaborative.com. I want to thank my colleagues for all the hard work that has gone into making today possible. And with that, I'm happy to answer a few questions, and then if you want more detailed explanations, I will defer you to some of the greatest people I get to work with, the men and women standing up here with me.
Mr. Speaker, can you talk about the $58 million that y'all are proposing to increase? That is still short of where you had hoped to be at the beginning of the current fiscal year. How do you decide what is enough?
How do we decide what's enough?
Right. Do you feel you're fully meeting the need?
No, I don't think we are, and I said that we consider this a very significant beginning, but it is not the end. It just is part of the beginning, and we're going to keep working on it. I think we've added a huge amount of new resources to this important issue. It's never as much as you hope to do, but I think this was a realistic effort, and I think it sends a strong message that we're making mental health a priority in Georgia. Any other questions?
Clarify some of the amendments in the Beverly Amendment, how did that change things?
I'm sorry?
The Beverly Amendment that just passed. Could you clarify how that adds to this, the Beverly Amendment that you want to vote on?
The amendment failed.
Oh, it failed, excuse me.
Along those lines, if the Biden administration is taking another look at the state's waiver application, which is, I guess, why he proposed that. I wonder if the application is not approved under the new administration, if that does change the conversation about Medicaid expansion.
Well, we've been having that conversation for a while, and I think we had a civil and respectful discussion about it today. It's my hope that they will be receptive to what we're attempting to do here in Georgia. I think that was a major piece of legislation back in 2019. So I'm hopeful that they will look favorably on what we're trying to do, which is simply trying to tailor a Georgia solution to Georgia needs. But I think the important point today is not where we differed, but it's on what we got done. And this is a big deal. It's something that we could agree on and we got done together. Yes?
Mr. Speaker, some of the criticism from the other side has been that the budget lands a little too much on federal relief money from COVID and doesn't tap into the reserve, the rainy day funds. What's kind of your reaction to some of that?
Well, we tapped into the rainy day fund back after last session, as you know, to a large extent, and the federal government, under the previous administration, you know, had passed the CARES Act funding program and some other funding sources and made those available, you know, to the states. And so, you know, Georgia's like every other state in terms of utilizing those. I think, you know, we have to be very cautious in terms of drawing down large sums out of the rainy day fund. And, you know, I applaud the governor for his measured approach to that during last spring and summer. And hopefully we won't have to tap it again anytime soon, but you know, things do change.
Do a final question?
The money that was added for universities over what the governor had recommended, the 17 million, how do you feel that will help universities as they go out of the pandemic?
Well, I'm hoping that they will be able to get back to in-person learning, and hopefully maybe this will expedite that in some fashion. But also accommodating the needs of the faculty in terms of being, some of them needing to still be quarantined. And so I know that there's going to be some residual of online learning that will have to go on. But, you know, I think our goal, you know, not only in universities, but particularly in K through 12, is to get all of our kids in Georgia back in the classroom.
Thank you all.
Thank you all very much.
Speaker.
Thank you.